Hey guys, Don here. Welcome to the $1 Million Minute. I'll help you bring your practice to the $1 million mark and beyond. This is a recording from a day that I was in practice on a Friday. This is my routine day, so I had 34 patients scheduled. I do a lot more. I do a first half days with my nail tech. I'm training Margorie, so she was doing better. The way I trained her today, last week she was kind of working more the medical record, like the EMR, putting patients in. This time she was putting patients in. I kind of went and said hi to the patients, and then I let her be and do the nail trimming, and then I would come back and do the calluses and just check on the patients that are needed. I'm only going to go through some of the routine things that were kind of importance, meaning the ones I would have an office visit with. There was a patient that came in that wanted a nail sample for nail fungus treatment. She's a 77-year-old female. I took a nail sample. I'm going to see her back in 3 weeks. This was actually a day also I didn't have Margorie, my scribe, for the first half of the day. So what happened is, first half of the day, nail visits are not that complex, so I'd dictate any of the ones that were specific. And then by noon, his internet was back, so he was able to make up for the previous 2 days. Another patient that came in with a fracture to the 5th metatarsal head. So I got x-rays, put them in a cam boot, and I'm going to see them back. To see how they're doing after that. That was an office visit. And then another patient that came in for a nail sample. So this is all, that was pretty much my morning, and there was a whole bunch of routine cares. Afternoon, 77-year-old male with a second digit infection, so I did an IND for this patient and see him back for nail care. Then I had 2 orthotics in the afternoon. One gentleman, he had a left 5th met head bursa, so really kind of a big soft tissue mass under the 5th met head from the lack of padding there. So I did an orthotic to offload that area for him. And so that was, I did an x-ray on that. I also did an ultrasound to make sure there was no infection. He was treated by his primary care for an evaluation for possible infection, gave them an antibiotic, but it did not look like that. It looked like more of a bursa for that gentleman. There's an 84-year-old female. I guess they threw a couple of nail cares in there as well for the afternoon. Not sure why they did that. Another 12-year-old boy with his dad came in. I went through all the wart treatment options, and they opted for wart removal. So I removed that in the office. See him back in 3 weeks. Another patient that came in for nail visit number 2, which is actually the one where I would give them the oral antifungal. They also had some issues where they needed orthotics, so I scanned them for orthotics as well. Another patient was a new patient, 68-year-old patient for nail care. New patient visit, that's why they put them in on kind of non-routine times. Another patient was a 55-year-old patient for EPAT number 3 for insertional Achilles. Now this is one that I'm trying to switch from 3 to 6 EPATs. At the recent shockwave conference, they recommended more 6 so we can start seeing improvement by the 6th one. I'm still struggling a little bit with doing all 6 because it's a lot of visits. I would love to have a physical therapy assistant or someone doing them for me, just because it gets to be very repetitive. It kind of clogs my schedule, but I do see great results with that. So that's where I'm trying to up it from 2 to 3. That's just kind of one of the struggles that I'm having right now. I'm still doing all of them, so some weeks can be a lot of those visits. I just feel like I could train someone kind of the same way we're training the nail tech. I think I could find someone that could do at least a few of those. Another patient was a 38-year-old female with and needed an IND and one of her ingrown toenails. Then there was a 32-year-old guy that had some red spots on his toes, so I did... he had Raynaud or chilblains. And so for him and a couple of others, I made little short videos. So I've been starting to make some YouTube shorts. There's an app that I use called, it's like a scripting app where it puts transcripts underneath it. So I'm playing around with that. Just gives me some enjoyment during the day. I like to make videos. I like to teach. And so that's something I've been doing in between. So that was the day. I was training Margorie. Things went well. She's doing better. She's getting better at trimming nails, some of the thick ones that are the challenge for her. But that was kind of the day.